think the best reason for studying postgraduate research is simply because it excites somebody. That's really the most important reason. Postgraduate research can be hard work, can involve long hours in the laboratory, but there are moments when you discover something new that no one else has ever known before, and that's an absolutely wonderful feeling.
The philosophy of the Institute is that we're based on the hospital site, and the idea is to develop new therapies, new diagnostics and various technologies associated with improving patient care. And so the themes have really been organised to provide groupings to bring that forward. So aspects like diagnostics, we have themes with clinicians and scientists all working towards developing new therapies for the clinic.
This brings together researchers from disparate backgrounds, and we all work together on one problem. By bringing together academics from different disciplines, we're far more productive than we would be working on our own.
My research has been involved in determining the anti-cancer activity of statins in ovarian cancer cells. Statins can kill ovarian cancer cells which are relatively resistant to chemotherapy.
The facilities at Chemistry have allowed me to develop drugs for then testing here at the Guy Hilton. So at Chemistry we have all the equipment to synthesise them and then to analyse them, and then come up here and we can use the cell culture facilities, which allows us to test the drugs within an ovarian cancer cell line.
There's a great sense of community here, and the groups work together and collaborate, not just between groups at ISTM, but we also collaborate at Keele University as well, so in life sciences and chemistry.
The future of cancer treatments is probably encapsulated in the term personalised medicine. This means developing drugs to treat a particular patient's molecular abnormality in the tumour. So the idea is to identify what's gone wrong in the tumour and then select a drug that specifically fixes that problem. We're talking now about using much more focused drugs targeting the problem rather than a shotgun chemotherapy type of approach.
The research that we do is very multi-professional, and so links to the pharmacy school, to the School of Nursing, the School of Physio and the medical school are really important to our research. Those schools provide students, and to bring those students into the Institute and engage them in the research is really important in terms of developing research leaders of the future. For students, they want to go to an environment where they know it's performing well and the research is having impact. The REF is the Research Excellence Framework. They tell us how we're doing in our research. The results have been really excellent for Keele in demonstrating the benefits of having this institute, which is based on a hospital site, and we can directly affect our patients in our community. People are all very different, and what we have to do is try and prescribe medicines which enable them to be most effective in that mixed community. This research is really looking at some of the genetics of the people who come down with ovarian cancer and whether we can tailor the medicines to meet those different genetic makeups of the different patients.